Part 1. Pathogenesis and Pathology of Malaria. Let's analyze the enemy. We are looking beyond the vector and the species to understand the weapon itself. We are analyzing the invasion. Let's look at the enemy profile. Don't just memorize the names, understand that different species wield different weapons. P. falciparum, this is the heavy hitter. It targets all ages of RBCs and causes the most severe damage. P. vivax and P. ovale, these have a trick up their sleeve. Hypnozoites. These are dormant forms in the liver that cause relapses. And P. malariae, this plays the long game linked to chronic nephrotic syndrome. But remember the core concept. Pathogenesis is not just infection, it is damage. So how does it damage you? It uses a two-hit combo. Branch A is hemolysis. This is the explosion. It's the destruction of RBCs leading to anemia and fever. It's the noise you hear. Branch B is sequestration. This is the blockade. It's the silent killer that blocks blood flow and takes out the fortress. It is mainly seen in P. falciparum. Let's break down mechanism number 1, the explosion. First there is entry. The parasite enters the RBC. Consumption, it eats the hemoglobin and multiplies. Then detonation. Boom, the cell bursts. The parasite eats the hemoglobin and the pressure builds up for RBC. It is like bye-bye, tata, goodbye, gaya. It releases hemoglobin, digestion pigments and toxins. Loss of RBC count leads to hemolytic anemia. And crucially, when the cell bursts, the parasite's disguise is gone, the immune system wakes up. This wake-up call triggers the fever cascade. RBC rupture releases toxins like GPI anchors. Your macrophages detect these toxins, we call this the scream. They release cytokines TNF-alpha and interleukin-1. These hit the hypothalamus. The result? That classic shivering and fever spike. The fever isn't the parasite, it's your body's alarm system reacting to the debris. Now for the killer. Mechanism number 2, sequestration. This is a falciparum special. Normally, blood flows like a highway, but falciparum adds PFEMP1 proteins to the RBC surface. These proteins are like Velcro. It turns a highway into a parking lot. The RBCs stick to the endothelium causing cytoadherence, and they stick to other RBCs causing rosetting. The consequence of this traffic jam? Obstruction. Microvascular blockage due to clumping. Ischemia, disruption of blood flow, and hypoxia, no flow means no oxygen. This blockage is the root cause of organ failure, especially in cerebral malaria. The tissue simply suffocates. So where does the debris go? To the battlefield, the spleen. The spleen is the RBC graveyard, as we all know. In malaria, it works overtime to clear infected cells. The massive workload causes enlargement of the spleen known as splenomegaly. It fights the hardest, so it pays the highest price in structural damage. You need to know the difference between acute and chronic spleen. In acute malaria, it is soft, red and swollen due to congestion. In chronic malaria, it is massive, hard, brittle and black. This is due to fibrosis and pigment accumulation. Remember the texture, acute is soft and chronic is hard. Why is it black though? The parasite digests hemoglobin but cannot break down the heme. It turns it into hemozoin, a brown-black waste pigment. This leads to the ague cake spleen. Ague means fever and cake means a hard mass. If the spleen is black, it tells you the war has been going on for a long time. Just remember the term ague cake spleen. Now to the brain, cerebral malaria. Here we see Dirk's granuloma. This is not a true granuloma. There are no giant cells or epithelioid histiocytes. It is a patch of necrosis and repair caused by the sequestration of parasitized RBCs in brain microvessels. Finally, the kidney, Blackwater fever. Intravascular hemolysis spills hemoglobin into the plasma. The kidney cannot filter this sheer volume. Result, hemoglobinuria. You get dark black urine. It is a distress flare. It means the RBC destruction is out of control. There is renal failure. Let's recap. Mechanism, the two-hit combo hemolysis plus sequestration. Molecule is PFEMP1, the Velcro of RBCs. Fever trigger are GPI anchors releasing TNF-alpha. Spleen looks like ague cake, chronic, hard and black. Pigment is hemozoin. Brain gets Dirk's granuloma and kidney gets Blackwater fever.